Hi everyone, this video is on different skin findings that we can see in lung cancer patients even before a diagnosis of lung cancer is made or even before some of the respiratory symptoms of lung cancer manifest themselves. Most people think lung cancer starts in the lungs, with a cough that won't go away, chest pain, or shortness of breath. But what if the body starts giving warnings long before the cough ever appears? What if some of the earliest clues don't show up on an X-ray or CT scan, but on the skin? It may sound surprising, but in some people, lung cancer announces itself quietly through changes on the skin. Rashes, thickened skin, dark patches, clubbed fingers, or even unexplained itching can appear months before respiratory symptoms begin. These signs are often overlooked, dismissed as allergies, aging, or simple skin problems, yet they can be powerful early warning signals. In this video, we're going to talk about the skin findings that have been medically linked to lung cancer, why they happen, and why recognizing them early could make a real difference. This is not about fear, it's about awareness, because sometimes the skin speaks before the lungs ever do. Now, let's discuss why lung cancer can affect the skin. Lung cancer doesn't just stay in the lungs. It can release hormones, inflammatory proteins, and immune signals that travel throughout the body. These substances can affect blood vessels, skin cells, pigment production, and even how skin grows and repairs itself. Doctors call many of these changes paraneoplastic syndromes, conditions caused indirectly by cancer, not by the tumor pressing on tissue, but by the chemicals and immune responses the cancer triggers. The skin is especially sensitive to these signals, which is why changes there can appear early. The first sign we will start with is clubbing of the fingers and nails. One of the most well-known skin-related signs linked to lung cancer is finger clubbing. This happens when the fingertips become rounded and swollen, and the nails curve downward more than usual. Over time, the fingers can take on a bulb-like appearance. Clubbing occurs because lung tumors can alter blood flow and oxygen signaling, leading to increased blood vessel growth and tissue changes at the fingertips. While clubbing can occur in other lung and heart conditions, when it appears without a clear cause, especially in older adults or smokers, it should never be ignored. Another skin change linked to lung cancer is acanthosis nigricans. This appears as dark, velvety thickening of the skin, often in the neck, armpits, groin, or folds of the body. Many people associate this condition with diabetes or insulin resistance, but in rare cases, it can be a paraneoplastic sign of internal cancers, including lung cancer. When linked to cancer, acanthosis nigricans often appears suddenly, progresses rapidly, and may involve unusual areas such as the face, lips, or hands. The underlying cause is abnormal growth signals released by the tumor that stimulate skin cell proliferation and pigment production. Some people with lung cancer also develop dermatomyositis, an inflammatory condition that affects both the skin and muscles. Skin signs may include a purplish rash around the eyes, reddish or violet patches over the knuckles, elbows, or knees, and extreme skin sensitivity to sunlight. What makes this concerning is that dermatomyositis can appear months before cancer is diagnosed. The immune system, while trying to attack the cancer, mistakenly targets the skin and muscles as well. When this condition appears in adults, especially without a clear trigger, doctors often investigate for hidden malignancies, including lung cancer. The next is unexplained itching without a rash. Persistent, generalized itching without an obvious rash can also be a subtle warning sign. This type of itching doesn't improve with moisturizers or antihistamines and often worsens at night. In lung cancer, itching may result from inflammatory substances released into the bloodstream or from immune system activation. While itching alone is common and usually harmless, chronic unexplained itching, especially when combined with fatigue or weight loss, deserves medical attention. Lastly, sudden skin thickening or tightening. Rarely, lung cancer may be associated with scleroderma-like skin changes, where the skin becomes tight, shiny, and thickened, particularly on the hands or face. These changes can limit movement and give the skin a stretched appearance. Again, this occurs not because the cancer has spread to the skin, but because the immune system is reacting abnormally to the presence of a tumor elsewhere in the body. Now, why these signs are often missed. The reason these skin findings are so often overlooked is simple. They don't look like cancer. People assume they're dermatologic problems, aging changes, allergies, or autoimmune issues. Even healthcare providers may treat the skin without asking why it appeared suddenly or progressed quickly. But context matters. When skin changes appear unexpectedly, worsen rapidly, or don't respond to standard treatment, especially in someone with risk factors like smoking, long-term pollution exposure, or family history, they may be the body's early alarm system. In conclusion, if you or someone you know notices unusual, unexplained skin changes that don't improve or don't make sense, don't ignore them. Ask questions, Seek evaluation. Early awareness saves lives.